Guys, welcome to SKK Classes NZ again. So today, after a long time, I'm just making this video, and today our topic of discussion is dengue fever. So I think you people are quite familiar this about this disease that is dengue fever. So today we will discuss about the dengue fever, its signs, symptoms, and its stages, and what type of treatment that should be provided to the patient, or what type of diet that we can give to the patient if he or she is suffering from dengue fever. So let's discuss about the dengue fever. We are talking about the dengue fever. So dengue fever is you can say is a type of fever that is caused by the mosquitoes, or you can say it is a mosquito-acquired disease, which mostly occur in the tropical as well as in the subtropical areas of the world. Okay, and sometimes the dengue fever is having a no sign symptoms, but if the patient is having a sign symptoms, that can be high fever and having a like flu-like symptoms. Okay, and the severe form of dengue fever that is also called is dengue hemorrhagic fever. Okay, hemorrhagic means in the advanced stage of the dengue, the patient is having a hemorrhage, means due to any reason, and this cause a serious bleeding, or it can lead to a sudden drop in the blood pressure. Because if the internal hemorrhage is there, so what will happen? The blood pressure that will gonna decrease. Now the question arises that what type of signs symptoms are there in a patient who is suffering from dengue fever. So first one is your high fever. Mean patient is have always having a high fever till 100 to 104 degree Fahrenheit. Okay, and the patient is always like a complaint about the I'm having a headache and muscle pain, or you can say bone pain or joint pains, and this pain is so terrible. And the patient always feel nausea, vomiting, and sometimes you can say pain behind your eyes, and having a swollen glands, and rashes are also there. So these are the main signs symptoms of the patient who is suffering from the dengue fever. Some dengue fever that can recover within a week. Okay, but in some cases, if it's not recovering within a week, so it can lead to some life-threatening condition of the patient. Okay, so because in severe condition of the dengue, what happen? Your blood vessels become damaged and leakage will be there. Okay, as all of you know that what happened in the dengue fever, that your platelets level that's gonna decrease in your bloodstream. Okay, and that can lead to shock, internal bleeding, organ failure, and even death. If I'm talking about the warning signs of the dengue fever, that can lead to severe stomach pain, persistent vomiting, means you are continuous doing the vomiting, and sometimes like if you are having a bleeding from your gums, from your nose, even though if the patient is like doing the brushing in the morning, brushing the teeth, so that brush can sometimes cause bleeding in the gums, and you always have like a blood in your urine, blood in your stool, blood in your vomiting. Okay, and sometimes the bleeding can occur under your skin and you can easily see. Okay, and which might like a bruising, like bluish discoloration of the skin is there. It means that you are having an internal bleeding under the skin. And sometimes due to in the light threat, in this severe condition of the dengue, the patients have a deep, difficult, or rapid breathing is there, and loss of fatigue. Patient is quite, you can say, restless in this severe condition of the dengue fever. If this type of condition is there, what you have to do? You have to go to the medical doctor and you have to seek medical advice. Because if the dengue fever is recovering within a week, then it's okay. But if it's not recovering and you're feeling that your sign symptoms are getting worse, then you have to seek medical advice immediately. So this is all about the dengue fever and its sign symptoms. In our next video, we will discuss about the treatment plan and what type of diet that we can give to the patient, or what type of diet that the patient can eat by own. We will discuss in our next video. So till then, thank you for watching SKK Classes Answers, and don't forget to subscribe my channel. Thank you.